let's talk seriously now about COPD. It affects nearly 16 million Americans, leading cause of death worldwide. I didn't realize that. Luckily, it's largely preventable, and Dr. Brent Wallis now from People's Health is going to discuss it and ways to lower your risk. And, Doc, I guess the first thing is, what is COPD?
Yeah, sure. So COPD really just stands for chronic obstructive pulmonary disease or lung disease. And that's really the umbrella term that we use to describe several different types of lung disease, but they are all long-lasting and require ongoing medical care. And so the two most common conditions that people are familiar with and we see the most often are emphysema and chronic bronchitis. People, with COPD can sometimes even have both of those conditions.
I know a lot about this because my dad served in the military when he was 16, got hooked on the damn cigarettes. I know what it's like. So I know the answer to a lot of these questions, but for people that have not been through it, can you tell them more about the conditions of COPD?
Yeah, definitely. So when you inhale, your lungs expand, to take in the air that's around you, and the oxygen in that air moves from your lungs into your bloodstream, and that's how you get all the oxygen to fuel your cells and do everything we need to do. So what happens with emphysema is the little air sacs in the lungs that usually allow the oxygen to transfer to the blood become damaged. They might even become all fibrotic and scarred, and they can rupture. And then with chronic bronchitis, the airways in the lungs, so the tubes that actually carry that air down to those little air sacs, which are called bronchi, they actually become inflamed and often can be filled with mucus. And so what happens with both conditions, it makes it really hard for the lungs to take in the air and then extract that oxygen and move it throughout the body.
And what is it that causes COPD, Doc?
Well, absolutely. Like you said, the most common cause is cigarette smoking, and it accounts for actually about 80% of COPD-related deaths here in the United States. And it is dependent on how much you smoke, very much so. So the more years you smoke and the more packs per day that you smoke, the greater your risk is going to be. And keep in mind that it's not just smoking cigarettes, it's also pipes and cigars and e-cigarettes can actually increase your risk of COPD as well, as can exposure to secondhand smoke. So that's really important if you live in a household with someone who is a smoker.
Smoking, a very important causative factor, but you can get it even if you've never smoked, right?
Yeah, you can. So about 1 in 4 adults that have COPD have never smoked a cigarette, and some of those can be due to secondhand smoke, but it can also be due to things like long-term exposure to other lung irritants, things like chemical fumes or vapors, dust, things that usually you're going to get exposed to in your workplace.
And with my dad, God rest his soul, it was a little bit of the cigarette smoking and exposure at the workplace. What are some other risk factors for COPD?
Yeah, the other biggest risk factor is age. So it's much more common in older adults. As you get older, your lung function really does naturally decline, and the older you are and the longer you've had those irritants kind of building up in your lungs, the more chance you're going to develop COPD. And then one of the other big risk factors we see are people who have asthma or have had really frequent respiratory infections, even when they were in their childhood, because those chronic inflammatory, responses that your lungs have can lead to this long-term chronic obstructive lung disease.
What are some of the symptoms of COPD?
They're going to vary from person to person, and they're going to vary in severity, but they usually include things like wheezing, chest tightness. Almost everybody has shortness of breath, trouble catching their breath, and then a lot of people will develop a long-lasting cough. And like I mentioned, the cough usually is very wet, has a lot of mucus, included in it. And keep in mind, by the time those symptoms are appearing, the lungs are already damaged. And because COPD is a progressive disease, so that means that the symptoms don't just go away, they actually get worse over time. You want to make sure you talk to your doctor right away if you've got any of those symptoms or if you've got any of those exposure risks, because early treatment can really prevent a lot of the complications and make it easier to manage the condition.
I know it's Christmas, and we're not trying to be unpleasant, but I will just add, if you want to give your family one of the best presents you can, you need to give up smoking, because And I know some people have this false equation in their head. Well, you got to die of something, and they think it's going to be like a lightning bolt. But I can tell you what my father went through, not you, doctor, but the audience, which was the final years of his life confined to a hospital bed, tube fed because of coughing so violently it damaged his vocal cords where he couldn't swallow anymore, couldn't eat. And he spent the last, I'd say, 10 days of his life in and out of consciousness, throwing up blood. Again, I'm not trying to upset anybody, but it's not going to be one quick lightning bolt that takes you out. So you need to put the damn cigarettes down. Talk about COPD and effects on mental health, if you will, Doc.
Yeah, I mean, like you said, this is a terrible disease and a really horrible way to die. And it's very common for people with COPD to have feelings of sadness or anxiety about their condition. One thing in particular, COPD makes it very difficult to breathe, and so you get very anxious about that. It makes it difficult for you to do, simple tasks around the house, things like showering and cooking, or even simple walking down the street. So when you're having difficulty coping with this sort of serious illness, it can get really severe and can definitely affect your mental health. And so you want to make sure that if you have COPD and you have some of these feelings of depression, sadness, or anxiety, you want to talk to your physician about it. That can be treated in addition to the COPD as well. So make sure you're real honest with us.
How do you treat COPD? Well, tell you what, let me take a break, Doc, and I think it's a good point for everybody to think about what we've talked about so far. When we come back, we'll talk about treating COPD. We're talking about chronic obstructive, help me out, Doc? Pulmonary disorder. Even when my dad was sick, I couldn't keep it straight. Chronic obstructive pulmonary disorder with Dr. B. It affects nearly 16 million Americans, leading cause of death worldwide, but it is preventable. And when we come back, we'll talk about some ways to treat. And I just felt so bad for my dad, who had worked hard all of his life and spent the final 10 years of his life just laboring, trying to breathe. He was going through all the motions, just wasn't getting any oxygen. 8:20, time for traffic now, WWL. Tommy Tucker, WWL 825, talking to Dr. B, Dr. Brent Wallis, our friend, Chief Medical Officer over at People's Health, and we're talking about COPD, chronic obstructive pulmonary disorder. It kills a lot of people in the world and primarily caused by smoking. Doc, what are some of the ways, as we continue the conversation, that you treat COPD?
Yeah, I mean, like other diseases, we've got a lot of medications that can be used to treat the symptoms of COPD, but the absolute most important thing you can do is breathe clean. You need to eliminate what that cause of the disease was. So if you're smoking, you've got to try to quit. And a lot of people have said to me, I already have COPD, why should I quit smoking? The damage is done. But that's not true. You can actually see a lot of improvement in your lung function about 2 weeks after you quit smoking. So it is not too late. You really need to do it now.
It's not easy to quit, but there are resources available, right? And some tips?
Yeah, there are. Definitely talk with your doctor about it. We've got medications that can help. We've actually got a lot of resources we can help to connect you to. The most important thing is going to be really kind of personalizing a plan. So work with your doctor on that. It's hard to quit smoking, and you've got to have a lot of support, family support as well, and make sure you're not in a situation where you're tempted. There's a helpline as well that actually has a lot of great resources. It's 1-800-QUIT-NOW, and they provide free coaching, to help you quit smoking. They're available 24 hours a day, 7 days a week. You can also go to smokefree.gov, and there's a lot of useful tools and tips there as well.
Before we wrap it up, let's talk about living with COPD. My dad did for about 10 years. I presume some things have changed since then. It's been about, 20 years since he's been gone. What are some of the things that can be done to help manage people or the conditions living with COPD, Doc?
Yeah, so, like I said, there are a lot of medications that we can use to help the symptoms. So you want to make sure that you're taking them and you're using them consistently. The other thing is talk to your doctor about something called a COPD action plan. And this is something really important that I do with my patients. what it is it's kind of a written list of the steps you need to take if you feel like you're having an exacerbation of your illness. And because it can wax and wane a little bit, and so you may get exposed to either different weather or an allergen that can really flare up the disease. And we can give you steps to take or certain medications you can start taking right away that can keep you out of the hospital or the emergency room in particular. So ask about that action plan.
And I guess things like flu shots and so forth, you want to make sure that your respiratory health is as good as it can possibly be?
Yeah, absolutely. Just like all chronic diseases, don't discount, healthy lifestyle choices. I mean, things like diet can make a big difference. Anti-inflammatory foods like whole grain fruits and vegetables. Staying active is good. Exercising your lungs is going to help them. And like you mentioned, it is super, super, super critical for people with COPD to get the flu shot every year. You want to talk to your doctor about the pneumonia vaccine as well. And now we've actually got an RSV vaccine. So you don't want to get an additional infection on top of your COPD because that's really going to cause a lot of problems and you'll probably end up in the hospital.
Let's talk about People's Health real quick. I know you guys are 5-star Medicare Advantage plan. There aren't a lot of those, only 32 in the country. So not even one in every state, the only one in Louisiana. The open enrollment period has passed, but it's different if you're a 5-star plan, right?
It is, yeah. So because we are 5-star for next year, you still have the opportunity to use the 5-star enrollment session. And so you can actually call us. We can explain what that means to you, but it gives you the ability to switch plans if you feel like you want to go with something else. And you can absolutely come in and talk to us at our Medicare Center in Metairie, right next to Party City on Veterans, or give us a call. Walk-ins are welcome at the service center, but you can make an appointment too, and we'd love to talk to you. We're there every day except Christmas and New Year's.
Thank you, Doctor. I appreciate your time. Real quick, somebody texted in about marijuana, vaping. It doesn't really matter what it is, does it?
No, those are toxins as well. So anything you inhale can cause COPD or any of these lung diseases. So don't think that that's safe.
And that goes back to what was the phrase you used? Breathing clean. Unless it's clean air, you don't want to breathe it, right?
Absolutely. Stay away from it.
Thank you, Doctor. I appreciate your time. Hope you and your family have a very Merry Christmas, Happy New Year. Same with you and everybody at People's Health.
Thanks a lot, Tommy. You too.
A pleasure as always.
See you in the new year.
You too, sir. You can meet with any of the representatives in person at the People's Health Medicare Center in Metairie. That's 3017 Vets, right next to Party City. Appointments are recommended, but walk-ins are welcome. You can also find out more at peopleshealth.com, or you can follow People's Health on Facebook and Instagram. Time now, WWL First News. For that, we go to Dave Cohen.